Many women ask me, am I a good candidate for breast augmentation? What I tell them is, what are you trying to achieve? If you've had children and you've lost some volume in the breast, you would be a good candidate for breast augmentation, assuming that you want to provide a little bit more volume. You may also need to have something called a breast lift, which is to reshape the breast tissue around the implant to really make the shape nice. For me, when I discuss breast augmentation surgery with patients, my decision about whether somebody's a good candidate really depends on what the patient is looking to have as a result and whether or not that result is a realistic result. It's very easy for people to see photographs of others and assume that they can look just like that. But the truth is everybody is different. The structure of their body varies as far as the skin type, the shape of their rib cage, and there are a lot of other factors that go into whether or not you can produce a particular result by placing a breast implant. As long as that person is reasonable and understands what they can get out of breast augmentation surgery and they have a very good idea of what it is that they want to look like, they're a terrific candidate for it. I spend a lot of time with patients talking to them about what it is they want to get out of breast augmentation surgery. For some women, they want a really dramatic result. Some want a very subtle result. Some just want to restore their body to what it was like before they had children. One of the things that we do is we sit people down. We actually give them what are called implant sizers. And those are like breast implants, but they give you an idea of, for a given volume of implant, what you would look like. And we tell them to try on their own clothes on top of it. They look in a mirror. We give them as much time as they want so that they can really be comfortable with the size. I hear stories all the time about women who have had surgery before for the replacement of breast implants who didn't realize what size they were until after the operation, and that can be very distressing. I want to make sure that my patients come out happy, and that usually means they come out with what they wanted when they went into surgery. And when the patients are able to participate in that decision, it's much easier for them to be thrilled with their results. So being a good candidate for breast augmentation means understanding what the procedure is and what you can get out of it. Once you've done a little research and you've had a chance to talk to somebody about it, that's when you find out whether or not the procedure is right for you. This is Dr. Kutty. If you have questions about breast augmentation or breast lift surgery or anything else to make you look better, please give us a call. Our phone number is 281-313-0551.